Hey junkies! Today we're going to talk about a corrective flexibility technique that you can do called SMR, self-myofascial release, or foam rolling. So essentially what it does is it targets trigger points, which are bundles of muscle spindles, the things responsible for making the muscle contract in the first place, that get tight over time. You find that trigger point, you hold the foam roller on that little tender spot for at least 30 seconds, which triggers a process called autogenic inhibition. The Golgi tendon organ tells the nervous system like, hey, it's okay to relax that muscle now. And then we start to smooth out those trigger points. We get all the muscle fibers going in the same direction. We decrease muscle spindle excitability, and voila, we can move in a relatively pain-free manner through a wider range of motion. So how do we do it? Well, just dive in. We'll start with the calves. So like I mentioned earlier, we want to find a place of tenderness, the trigger point, where the muscle spindles are all tight, and hold it for 30 seconds. Then we continue to roll onward so that the muscle gets the cue to, hey, we're going to smooth out and not remain balled up. So if you want to practice on the calves, you'll take one leg to the foam roller, cross the other leg over top, lift your buttocks up, and then slowly start to roll. And then when you find that point where you're like, ugh, can't breathe, well, stay there and breathe anyway. 30 seconds, which is about 8 to 10 deep breaths in and out. Then you continue to roll past the point, and then you can roll back as well, and then you'll change sides. You can also do this for the side of the calves, the perineals. Move up the leg to the hamstrings, those tight hammies, especially biceps femoris short head out here. Place one leg on the foam roller. We lift up, we go, and we find that trigger point, and we hold for 30 seconds, and we breathe, and we're alive and well. Then we roll past it. Don't go underneath the knee. Don't go onto any joint for that matter. And then you can go the opposite way, smoothing out that tight muscle. For the quads, we can start up near the hip crease, and we use our leg to slowly roll us forward and back. We hold at the tender place, 30 seconds. Keep on rolling. Again, you don't want to go past the knee, and then you can roll back, change legs, and don't forget, hold and breathe. TFL IT band head. So this is a controversial thing because the IT band is a tendon. There are some places that say like never foam roll it. There are some places that are like go for it. I like to stick to the upper quadrant of the outer thigh. So a good way to come into it is place the foam roller right at the top of the pelvis, that iliac crest. Place the opposite leg in front. Then you're going to slowly roll and think about internally rotating the leg. I go to just about the upper hip, holding on any tender spot for 30 seconds, and then going back up. Okay, finally the lats, that big muscle on the back that attaches to your underarm. So that's actually where we place the foam roller. We want our arm that's going to be foam rolled with the thumb pointing up so it's externally rotated. And we start at the underarm and we slowly go until about you're underneath the shoulder area, not necessarily on the ribs there. You find the tender spot, hold for 30 seconds, then you can roll back. Breathe like you mean it. Okay, that's an introduction to foam rolling. I can't tell you how important it is for correcting postural imbalances in the body, which we go over later in the month with all of our everyday epiphanies as well. It's one of the best things you can do to rest and restore your body so that you can have optimal ranges of motion, proper muscle length tension relationships, and so you can like live pain-free. I think that's like the end game, yeah? So get your foam roller if you don't have one, and start practicing before and after exercise is a-okay.